you go. There you go. Great. So we're going to ask for your 1 or 2 headlines from this discussion. If a previous group reports something that you also agree with, then no need to go there. You can move on to your next priority. So let's start with table number 1.
Okay, we were broad, so see if you can fit into this. We started that everyone needs to be the teacher of the future, that we need to be listening to the people in the communities, patients, families, community leaders, and organizations, and how we actually bring a new vision, particularly related to culture and community needs and assets, so that the experiences of the health professions while they're going through their education is authentic. That we need to think about this community educator as both dealing with the individual health professions student and ultimately the health professions academy. Because unless the academy changes, we have true interconnection between the academy and the community. If we don't educate the educators, we will never be able to maximize the ability for the community to be the faculty and the educators of our students of the future.
Okay, thank you. Table number 2.
Sorry, when it says push, actually push the word push. Because that's what it says to do. Sorry, I digress. We have the great advantage of going second. I'm sorry for the tables at the end, because you're like, what are we going to say that they didn't say already? But we agree entirely this notion of cross and transdisciplinary, but we probably went a little further to say it's going to include people you might not suspect, like engineers and IT professionals and business administrators and architects, to build not only a healthy workforce, but a healthy city for people to live in. And then 2, which you also sort of touched on, but it's important enough to say, is it also extends into the community, so that people, formerly known as patients, will be teaching health professionals how to do their job and as to better integrate learning and service throughout the entire curriculum. And I think that sums it. Thank you.
Great. So just so the people at the end aren't tongue-tied in this discussion, so let's keep it to 1 or 2 professionals. So table number 3.
Moving down our list from what has already been said, we had extensive conversations around the idea that the teachers of the future will be the interprofessional team across disciplines, and that by doing that, any individual profession will avoid recreating wheels, and the idea that we need a flatter worldview culturally. We are all learners. So that was one. The other that I will pick from our group was the role of technology, Apple Glass, Apple Watch, online simulations, and crowdsourcing of patient input using technology.
Great, and I think I have table 4, and we talked about extensively about knowledge management, folks who can teach students how to get knowledge efficiently and then how to use it in terms of their decision making. And also, let's see what hasn't been said, quality professionals, folks who are really focused on quality and how that can be applied across curriculum. Number 5.
Thanks, Timmy. Our discussion echoes some of what was already mentioned about the importance of all of us being lifelong learners, and that the educators of the future are going to be a learning community, which is patients and all kinds of other individuals in the community and the health system. It will be a much larger view than what we even have today, and that radical change will occur in deinstitutionalizing the education process by bringing it out into the community. The tactics and strategies will continue to evolve to be more technology focused, but also 24/7 environment and on demand. And we envision who is leading will be very different, moving from learner guided versus faculty guided. Faculty will be facilitators of learning, much as advancing more of what we've already seen with flipped classroom. And we have a quote Sage on stage will be moving from Sage on stage to a guide on the side. And we also continue to focus on the paradigm shifts, which moves from disease management silo-based to wellness health team-based with more immersion and experiential learning.
Thank you. Table number 6.
Ditto, but we also brought up the terrifying and brave new world of self-education, MOOCs, wiki education, peer education, all being dominant now and will continue to be dominant. Probably a good thing, but faculty then need to have to understand what do we want the students to learn and what has to be guided, what has to be taught face-to-face and experiential, so that you can differentiate between what they can do in all these new modalities and what still has to be the core of what we're doing.
Thank you. Table number 7.
So obviously many of the things we talked about have already been covered. The one thing I will add is the notion of people in the community, so not just interprofessional learning from each other across the health professions, but beyond the health professions, beyond other academic disciplines like industrial engineers and such, but really how do we engage with people in the community, community leaders, particularly talking around issues of language and cultural concordance, for example, with the Hispanic community and population, working with community advocates and working with our foreign language colleagues who are helping to teach that. The caution we wanted to say with that is that we have to be very cognizant as we do this, not to use those people in the community for our students without it having an equal goal that's met for community leaders. This notion of you come out to us when you have a grant or changing a curriculum, that it's possible to do this and have all boats rise, and that the work that by them working with us to help teach our students, there are things we can give back in terms of encouraging their youth into health professions careers and encouraging other ways to help provide more opportunities for the communities we work with. We can't use them as teachers without making sure that we're equally giving back.
Perfect. And again, the perfect setup for the next question. And that question is, how will these evolving roles impact the educational process and the community? So what's the value to education of these new roles, and what is the value to the community? And I'd ask you in the next round to come back with one value for each group, concisely stated, so that we can move through till lunch. And in fairness, table 7, you're up first. So let's get started.